Good evening, TNT family. So we are fortunate this evening to have Dr. Lackram Bodoe, MP for Fyzabad. And Dr. Bodoe, I believe you are Shadow Minister of Health.
That's correct. That's correct, Gary.
Right. So I want to welcome you to UNC USA. Doc, we have some major concern what we have seen happen under this government for the last 9 years. Seems to be more chaos upon chaos with the health system, and we would like to get some feedback from you on what your thoughts are happening, and also what we would do differently as we take government uh, with the UNC government, and what our plan of action is. So if you can enlighten us, I want you to enlighten our listening audience, both inside and outside the country, because I'm trying to get people on board with us here from outside the country who have an interest in coming back home. We do definitely want to visit, and we are concerned about the level of healthcare in case of an emergency. You can't get an ambulance, you can't get proper care. So these are the things that we're concerned about. So if you can give us an enlightenment on what you see happening there as a doctor, and what our plan of action will be as we take government.
So, Gary, first of all, thank you very much for having me on UNC USA. And good evening to you, your panelists, and your listeners. Healthcare in Trinidad and Tobago, has been in a very chaotic state since 2016, since this government took power. And I do agree with your concerns. One of the things, in fact, one of the main issues when I travel to any destination, of course, is that I look at what is available in terms of healthcare. Um, and the same, of course, would apply in terms of those who want to come back to Trinidad as well as visitors. And we'll come back and talk a little bit about that. Um, but just to put this whole thing in perspective, Gary, annually, the health budget is second only to education. So, an average of $7 billion would have been spent over the last 9 years. That takes us to some $60 billion in the last 9 years under this government. And of course, in the last budget in October, a further $7 billion was approved. And the question really is whether the healthcare system, has seen any improvement with this expenditure. And I think the answer for the large majority of citizens is no. Now, again, if we look at the big picture here, a healthcare system, and in fact, the concerns in Trinidad, second only to crime, and perhaps the collapse in the economy and the difficult economy is healthcare. The surveys from our side, our party surveys have shown that people are very concerned about the lack of healthcare. Now, I wanted, I wanted, trash a myth which is often thrown about by this government. In fact, whenever the Minister of Health speaks in the Parliament, he's very keen to say that healthcare is free to all in Trinidad and Tobago. That's a myth. It is not free. It is paid for by the taxpayer. It may be free at the point of delivery, but the point I want to make is that having free healthcare is fine, but timely healthcare is also very important, Gary. Free healthcare to someone who has to wait and dies or gets worse while waiting is of no value. So you ask about the policy of the United National Congress when we get into government, and we are going to regard, and we've always regarded healthcare very, very high on the agenda. Um, you will recall, and those who are listening on would recall, that during the period 2010 to 2015, under the leadership of then Prime Minister Kamala Prasad-Bissessar, healthcare was very high on the agenda. Um, Again, let me just put. I like to use a little, you know, little synonym acronym really to talk about healthcare. So our vision, the vision of the United National Congress under the leadership, um, and the vision we propose to carry forward, would be based on what I would call the, the six P's. So there are three P's, and the first three P's, it all goes to your vision, and the first three P's has to do with the plans, and the programs and the policies. So that is at the administrative level. This is where decisions will be taken at the level of the government, the cabinet, and the Ministry of the Health, and so on. So you must have your plan for what you want to deliver, and you're going to deliver with your policies and your programs. But the execution arm of this is also three P's involved, and just those P's will be plant meaning infrastructure, people, and process. So I just want to couch everything in that. And in terms of the health sector in Trinidad, um, we would have ensured between 2010 and 2015 that the plan, the infrastructure, was well laid out. As you will recall, again, it's very easy for citizens to take things for granted, for people to forget, and so on. But when the People's Partnership Government entered government in 2010, the San Fernando General Hospital was in a very appalling state. Um, People will recall that there was a long time for waiting for beds, and there was a situation where citizens had to sleep in the corridors and so on. That, of course, was remedied quickly in terms of the construction of the San Fernando Teaching Hospital, which would have added another 214 beds in January of 2014 when that hospital was commissioned. Um, that had, made a big impact, a big difference to healthcare for those seeking healthcare in the southern part of the country. Um, Unfortunately, that hospital, which is now 10 years old, um, has not been well maintained. There are reports of lack of maintenance and many maintenance issues and so on. If one were to drive past the hospital just from the outside, there have been two panels which fell off the wall of the hospital, has not been replaced. And, I hate to say this, Gary, but, I've had reports that apparently it's the intention um, of those in charge, to let things run down, which is very, very unfortunate. But we spoke about plant and infrastructure, and of course, the maintenance is one of the issues that we've seen under this government, or rather, the lack of maintenance. There have been many issues in all of the hospitals in terms of the lack of maintenance and so on. But again, just to talk quickly again about the infrastructure that was put into place. Of course, the Scarborough Hospital was completed by the partnership government. That was our first project in 2011. 2014 was the San Fernando Teaching Hospital, and a very significant upgrade of many of the health centers. I believe some 40 or 50 health centers out of the 103 health centers we have in Trinidad and Tobago would have experienced a significant upgrade in terms of infrastructure um, during the time. Um, and of course, so the plant is there, the infrastructure is there, and of course, the ground was laid for the construction of the long promised Point Fortin Hospital, which has now been opened, and the Arima Hospital. So those came, planning and laying of the foundation and so on. It came into being under the partnership government. But let's just compare what has happened. Now, the Port of Spain Hospital, still with the infrastructure, the Port of Spain Hospital has been promised, that long-awaited refurbishment of Central Block has been promised by this government since about 2017, 2018, and we are approaching 2025, and that is yet to be completed. And I've left the Couva Hospital because, of course, in 2015, the Couva Children's Hospital is opened on the 14th of August 2015. I was there as chairman of the Southwest Regional Health Authority. I would have been responsible for overseeing the user brief and the construction of the Couva Children's Hospital. And again, we saw the politics playing out in 2016 when the government changed, and this PNM government first saying that the Couva Hospital was a construction site, using that as a reason for not opening the hospital. And they kept that hospital closed for 5 years until COVID came up in 2020. And within a mere 2 weeks, they were able to open the hospital. So obviously, this could not have been a construction site. It means that the hospital was ready and able to house patients and so on. So those are some of the issues in terms of the infrastructure. There are many, many other issues in terms of infrastructure that have fallen by the wayside under this government. Um, so that's one of the issues. I will pause at this point, Gary, in case there are any further questions.
Yeah,
Um,
Doc, it seems like this government has made all efforts to remove, to completely eradicate everything that was done to improve the lives of the people in the country.
Well, absolutely, Gary. When you look at what has happened in Trinidad and Tobago over the past 9 years, it is it is easy to come to the conclusion that you just made, that they've done everything in their power to make people's lives more difficult. From in terms of ensuring that you're no longer secure, in terms of not treating with the crime, in terms of not taking the measures to sustain the economy, and certainly in the health sector, um, a lot, you know, a lot has been done to make people's lives difficult. Now let's just give an example. I spoke about the refurbishment of those health centers, but we had gone further in our time under the then Prime Minister Kamla Prasad Bisesa. We had gone further in terms of extending the opening hours for these health centers. So there was a time when some 40 health centers, 40 or more health centers were open. Um, we had extended hours sometimes up to 8 o'clock, and on weekends as well, Saturdays and Sundays. And the reason behind this was that we wanted to make sure that those who wanted healthcare would be able to access healthcare very easily. And sometimes it would have been convenient for persons after they finish work to drop by the health center and have their blood pressure checked, have their blood sugar checked, have some tests and so on done. And of course, on a weekend, it would be convenient a Saturday and a Sunday. One of the first things this government did when they came into power is they stopped those extended hours, and of course that has worsened the situation in terms of waiting times and so on. So that's one of the issues. Another issue I can tell you about. Um, this is something very close to my heart, Gary, and no pun intended here. This, if let us just take an example. Let's take a live example. As we are speaking right now, let's say, God forbid, one of your relative, one of my relatives, Gary, and someone friend, family, a neighbor, gets a chest pain and has a suspected heart attack and has to go to the San Fernando General Hospital. The situation there is that that person is not given optimal care as you would experience in first world countries. And you raise the issue of people wanting to come back to Trinidad and expecting health care. And this is an important point, because when you go to the San Fernando Hospital, you're given the basic treatment. But what you really need for chest pain to exclude a heart attack would be something called an angiogram. And you cannot get an angiogram as we speak at the San Fernando Hospital. You have to pay for that privately. You have to go to one of the medical centers. If you don't have $10,000 or $12,000, you're not able to get an angiogram. And of course,
And you don't have the time either. I mean, especially in that kind of a situation where time is critical,
of
you need that upon within the facility there.
exactly. Now the government will counteract this and say, okay, they have a program where they pay for these investigations and so on. But the standard of care for a heart attack is something called a door to stent time of 90 minutes. So in first world countries, you get a heart attack, you go to the hospital, you get the angiogram done within a quick time frame, and you also get the stent done, and that is virtually a life-saving procedure. And in our country, as we know, heart disease is one of the major killers, hypertension, diabetes, and so on. So that is something. But I'm saying this to make the point that we had recognized that there was a need for a cardiac catheterization laboratory. That is a facility that does the angiograms and the stenting and so on. And we had put everything in place for this to come on board in 2015. As you know, the
At the
government
hospital. At
at
the
the
hospital.
hospital, at San Fernando Hospital. In fact, the space was identified. The space at the San Fernando Hospital is still there. It was identified. The tenders were sent out, um, and tenders were in the process of being approved. The government came on board and decided that they wanted to retender. That's fine. They retendered. But here we are 9 years later, and that cat lab is still to be constructed. This is one of the greatest travesties that has been perpetrated against the people, especially of the south of Trinidad and Tobago, because there is a cat lab at the Eric Williams Medical Sciences Complex. But having one cat lab in the public service is certainly not enough. And of course, the patients who seek care at the Southwest Regional Health Authority suffer. And this government really, again, it's one of the things that they're doing or not doing to make people's lives more difficult. So that is just one example, of how things can be improved, but it's definitely not been improved. And while all of this is taking place, Gary, while people are waiting for a cat lab that will cost maybe $30-40 million, in the meantime, this government chose to build a car park at the same San Fernando General Hospital. How ironical is this that you're building a car park, spending, I don't recall the figure offhand, but it's a considerable amount of money to build a car park, and yet you cannot or you would not build the cardiac cat lab. And every time we ask the Minister of Health in the Parliament for, a response, there's one excuse or the other, but we don't see it happening. But
Well, we see a lot of arrogance. What I've seen, I've watched Parliament a few times, and I've seen the level of arrogance towards you and the opposition in asking the question, and I saw the games playing deliberately, and it is very concerning for the fact that this government think that they own the country, that the taxpayer money belongs to them, and they can do what they want with it and don't have to answer to anybody. And these are some of the things we're concerned about.
it's a very important point. The role of the opposition, of course, is to hold the government to account. Our role is to ensure that taxpayers' dollars are spent with, transparency, accountability, and value for money. And therefore, it is our right and it is expected of us to ask the questions. But you're quite right. Whenever we ask the questions, they're very aggressive. They will not answer. Um, and you're quite right. So what you see happening in the parliament is the attitude that we encounter. Um, they're reluctant to answer questions. They're reluctant to account for expenditure of money. Um, as you speak, just to deviate a little bit, there's still the issue, the unanswered issue of this 2.3, over $2.5 billion that has not been accounted for. And you see the approach taken by the government, where now they were trying to force the Auditor General to move in a certain direction. So
Bully
again,
her. Yeah, bully her. They went out of the way to bully her.
exactly. Thank God for the Privy Council, and some sort of sanity prevailed in that situation. Yeah, and bullying would be the correct term in a situation like that. So it is an example of their attitude in terms of how they go forward. So there's a lot that needs to be done. And of course, you ask about our plans when we form the next government. And we certainly have many projects and programs that we are going to implement. Um, before I share some of those with yourself and those who are looking and listen on and so on, we spoke about the plant, we spoke about the infrastructure. We spoke a bit about the process in terms of putting things in place, cardiac care. Another issue that needs to be treated with is the issue of renal dialysis. We have many patients who suffer from chronic renal disease in Trinidad and Tobago, and they need regular renal dialysis. This is currently being outsourced at great cost to the government. Over $150 million annually is paid privately for renal dialysis. I'm not saying anything is wrong with public-private partnerships, but the capacity is there in the hospital, and that certainly a lot more can be done in that area. Now we spoke about one of the P's I mentioned was we spoke about plant, process, and people. Now, what about the human resource factor in the health sector? How are doctors and nurses being treated? Well, let us look at the nurses' situation first. We have a situation where we know that nurses are the backbone of any health sector, but they are not treated properly under this government, and as a result, we have a exodus of nurses. Nurses are seeking greener pastures. They're going abroad. They're going to the USA. They're going to the UK and other countries.
which
Simply,
I, which I'm aware of because I had a few made contact with me. while they
Well,
were relocating. You know,
exactly. So you know that. You, so it's real. And the reason is because they are not being treated properly in terms of adequate compensation and working conditions and so on. And the Trinidad and Tobago Registered Nurses Association, now called the Trinidad and Tobago National Nurses Association, they've made this point, and they keep calling for better terms and conditions. And of course, this government, as you know, does not seem to be a worker-friendly government in terms of the way they treat workers and so on. So that is one of the issues. The other issue with the human resource factor is the issue of the unemployed doctors. What is happening with the 400 unemployed doctors? This government is making no real effort to engage and to employ these doctors on a more regular basis. And of course, there is a need for more doctors out in the community. So that is another issue that needs to be dealt with, Gary.
I had one doctor who spent some time living in Venezuela, studying, and became highly qualified there. And somebody put him on to me to reach out to me. He has had he's this guy is qualified in so many things. I'm going to send you his resume,
Sure.
and he was having a very hard time getting any acknowledgement from the Ministry of Health, and then going on in circles, you know. And the guy has reached out to me a few times. He's within the country right now. He's in the central area, and he has a lot of qualification that we definitely need. So I also am aware of the staffing issues within, in as example, Mount Hope, with some of the doctors there, they are understaffed, and I've heard the horrors of Mount Hope, what it is, and that was supposed to be one of the best hospital when it was built. Um,
But there's no
and
funding.
I had one lady that was there at Mount Hope. In fact, I had helped her come back into the country, and when she was locked out, and she was there for 4 days, and she reached out to me, and she said I couldn't even get nobody to acknowledge me. They're walking by me, and as soon as I reached up, I had to go contact the Ministry of Health, and then after doing so, and a few doctors, she was able to get some medicine and looked after 4 days in the hospital. They were just walking by her. So I've heard quite a bit of horror stories, you know, about what's taking place. The people on the in the tent waiting outside can't even get a bed. I mean, so this, like you said, this healthcare system is not free. We are paying. There's a health surcharge. From the time I was a kid, my father was paying that health surcharge, as I'm aware of. So the level of disrespect is totally unacceptable to our people, and I'm hoping that they will take these things into consideration and listen to what we are saying and what we intend to do, and give us the support to help better their lives. You know, these health centers, I definitely think is very important to have open on a 24-hour basis, because then we all have seen happening, the overload in the hospital with things that could be handled at the local health center level, and creating, you know, unnecessary havoc. And so it is very important that we staff these health centers. We need a few more in the Point Fortin area. You know, the Mayaro area has that area where you have the oil industry taking place. You know, these things, this place, these remote areas, they definitely need to have that. I've discussed with Dr. Gopi Singh of the level of ambulance care uh, that we have here in this country. I mean, when you get into an ambulance, the ambulance starts to relate to the emergency room, you know, what's going on with you, your prognosis, or what they're skilled, as much as they're skilled to, and the communication starts to flow. So by the time you get in there, you know, the process is rolling. You know, so this is the kind of thing I'm looking for. I've discussed it with Dr. Gopi Singh, who is very entertaining on that, and he shares my views and things like that. So I've been collaborating with him quite a bit. So you know, I want this information to be made public and be reiterated as much as possible, so that people understand the direction we're going and the level that we're trying to improve their, you know, the level of service delivery.
Yes, certainly, Gary. I mean, you've made some very important points. That the ambulance service is one thing. This highly qualified doctors are very important. And you know, we're speaking here to the diaspora. We have a lot of qualified doctors who have left this country to work abroad, simply because they have not been given the opportunities to perform to the level of their skills and the ability and so on. in our country. And our intention when we get back into government is to ensure that we make it, attractive to bring back some of our specialists, so that they can serve their own country. And having a good healthcare system will also encourage tourism. Now, the intention when the Cuba Hospital was constructed is that it would be a center for medical tourism. It would be a state-of-the-art facility. It was designed in that way, and of course, it would encourage tourism not only from the region, from the Caribbean, but from other countries. And of course, we see now that with the issue with forex and so on, if we had something like that in place, then that would be a source of forex for the country, earning, you know, foreign exchange. So it was very visionary in the time, 2010, 2015. And had it been acted upon, then we would have had another source of foreign exchange. Um, but our intention as far as the health sector is we're very focused. I mean, we believe, that health is a right. Um, it is no longer a privilege. It is even recognized by the WHO and so on. But we have to understand that health is a right. And, that is, we start with that. And of course, our intention is to provide adequate healthcare, to provide timely healthcare. Timely healthcare is very important, as I mentioned in starting. I mean, fine, healthcare is free at the point of delivery, but if you have to wait so long for the healthcare, then that is of no benefit to you. If you get worse, you develop a complication or you die. So timely healthcare is very important, and timely healthcare involves not only having enough doctors to provide treatment, diagnosis, and treatment, but also having adequate amounts of drugs and supplies and so on. And that has been a challenge of
Exactly.
the government. The drugs, the CDAP program, the drugs in the hospital, and the CDAP program, has not been well administered by this government. So we intend to make sure and fix that. We intend to ensure that the drugs in the CDAP program is reviewed so that we can increase the number that is available to the public, and also, we would ensure that some of the more up-to-date drugs are available to the public. Now, we've gone a long way in terms of the treatment of diabetes and high blood pressure and heart disease. There are many newer drugs now that are, been proven to be beneficial, and it's our intention, to review that and to make the system more effective. Um, just before we came out of government in 2015, we had introduced something called the health card, and that would have been something where all of your health information would have been easily transferable, from one health facility to the other, and it would have helped the administration of the CDAP program and so on, make it more effective. But again, this is every measure it seemed that we left in place. They've managed to do away with it to the detriment
Uh,
of the
and
population.
this definitely has to be raised, publicly, that, because they're trying to even deny the very existence of this level of service that was provided, and we must not allow this for them to get away with this kind of a thing. I we have run into people of Trinidad descent over here who are highly qualified nurses and doctors. I even have foreign doctors here who are willing to help us, with our medical needs and stuff like that. Very high level brain surgeons, cancer uh, doctors, and stuff like that, able of doing this kind of stuff. And far as I know, this government has frustrated everybody outside. They won't engage. They won't allow them to engage them at all, to help at all, whether they're Trinidadian or anybody, not accepting any help. The way they are managing things. I have brought simple thing as the disaster preparation and response training. I got people on board to help us when I saw what happened with Brett and how unorganized we were. They won't listen. I saw the mishandling of the quarantine situation with the COVID, asking them to utilize the secondary schools to kind of expand our resources so that we could bring home people more quicker instead of forcing them to stay outside. Your family have to send money, find US dollars to support you outside there. People, I mean, who are outside for a 2 weeks vacation, had end up spending a year and a half outside here that I had to deal with personally. We had, so the government. There was no collaboration. They were totally arrogant. I have experienced that arrogance personally. And, I just want us to take all these things and how they handle the COVID situation and to be organized and prepared. So should we face something like this, that, we can have a plan of action rolling.
Leader of the opposition, as one of the proposals going forward, we believe that we agree with you that the COVID situation was mishandled, both from a clinical point of view and also from an economic point of view. I mean, the way the situation was managed led to a lot of closures of businesses and so on. So it impacted and affected the economy in a very significant way. But you're quite right. I mean, citizens suffered abroad for no good reason. And one of our manifesto promises is to conduct a proper and full inquiry into how the COVID-19 pandemic was managed. And we already saw from the Simongal report, which looked at the clinical aspect of the management of COVID, that the government fell very short. And before I leave the
Because
COVID,
there were drugs available to help.
that's right. So they did not make the effort to procure the drugs. As you know, there was quite a delay in the procurement of the vaccines. Um, and one of the biggest fallacies about COVID-19 and the management of COVID-19 under the PNM government, and the reason why we are in such a bad state in health even at this time, is that the government, fooled the population into believing that they had created a parallel healthcare system. So they were telling people that whilst they designated Cuba Hospital and other facilities, Cora and so on, to treat COVID patients, that patients were getting care in the regular hospital, San Fernando and Port of Spain and so on. There was nothing further from the truth. What they were doing is taking the same staff from these hospitals, assigning them to Cuba and other COVID hospitals, and it meant that the patients in the ordinary setting suffered, and we ended up with a backlog. And the Simongal report showed that they said very clearly that there was a backlog of patients with the NCDs, the non-communicable diseases, and this is why now we have that backlog which was created, and the government is doing nothing to address this. So one of our challenges, and we are up to it, would be to deal with this backlog in terms of those who are waiting for care, be it cardiac procedures, be it cataract surgery, be it hip replacement, whatever else needs to be done. So that is something that we intend to do. Um, we also are looking at re-implementing the extended hours that we had in the health centers, because we think this is very important in terms of,
Very, very
yeah,
important.
very, very important. We already spoke about revamping the CDAP program, um, and we also have on the agenda something called a stroke rehabilitation program. Now, in countries, developed countries in the USA where you are, Gary, you would know that if someone suffers a stroke, they are given access to physiotherapy, to occupational therapy and
A
so
lot
on.
of resources, a lot of
And
resources
the
involved.
resources are put into that. I remember myself when I was doing my postgraduate studies in the UK. I sustained a little injury to my hip, um, and I was amazed at the quality of resources that are available in terms of physiotherapy and so on. They make every effort to rehabilitate you and get you back on track so that you can get back to as full strength as you can, and continue to do what you have to do in the society. So we're looking at implementing a stroke rehabilitation center, um, in terms of
And
trying
even
to.
with that, timing too, timing with a stroke, time. The
Time is,
quicker you get the help that you need, it is highly critical with a stroke.
Gary, time, and that's what we are saying. Timely healthcare is very important. You know, so it is very important. So those are some of the measures that um, that we are looking at.
Um, Good night, Dr.
Adrian.
Good night, Dr. Bodo. Um, I would like to bring in something into the discussion. I don't know if you will remember, or you would be able to enlighten us. But one of the first during the COVID, since you mentioned COVID, I remembered it. When the COVID started, I remember on there. I am reading an article here from October the 9th, 2020, where the Minister of Health, Terence Dialsing, said that he joined the COVAX facility and $9.7 million US dollars were allocated in the budget to purchase 462,000 vaccines. This was the first order of vaccines that was purchased by the government. We never got any vaccines from the African Union, as far as I can recall, and we sent money to somewhere in Africa for these vaccines. I remember a young lady, a young reporter, asking this question about 4 times, and apparently almost got fired for it. Um, what happened? The last thing that Mr. Imbert told us is that that was a donation towards research and development. But the newspaper article and the minister clearly outlined in Parliament and in the media that this was for 462,000 vaccines at a cost of US $9.7 million. And I believe it was in the 2020 budget. I don't know if you recall and you
Yeah.
remember. We can probably ask that question in Parliament.
Yeah, well, I don't recall the figures exactly, but what I can tell you, and I think that's a very important point, is that, every time we try to clarify the amount spent on COVID-19, the government has been coming up with different answers, and they've been clouding the expenditure. First of all, they said that, because of NDAs, non-disclosure agreements, that they couldn't say what they were paying for vaccines and so on. So you're quite right. Right now we still don't know um, whether where the money would have would have would have been spent. But again, that is one of the things that we are going to look at when we go into government, to do a full and proper investigation, so we can look even at the expenditure on COVID-19, in terms of even the social. Remember, there was some expenditure in the social sector as well. So
Correct.
that's a valid question. At one time, the government was saying that we would get vaccines from the African Union, from various countries and so on. But in the end, it turned out differently.
Says here in the article, the Alsing said the move was accepted by cabinet decision and a cabinet note to invest 9.7 million or 66 million TT dollars to purchase 462,000 vaccines, enough for 33% of the population.
Yeah. Well, and that's a good point, the accountability. But the other thing that we've forgotten in terms of what happened in the COVID, and if you recall now that, I mean, there are issues about the vaccine and so on, but one of the issues was that the the government's failure to educate the public in terms of the importance of taking a vaccine when it became available, and therefore when the vaccines were purchased, I don't know if you recall, um, there were, in fact, we had reached a point where there were expired vaccines and so on.
Mm-hmm.
So there was a failure in terms of public education. Um, but as I said, we will undertake we will undertake to do a proper, full investigation into how the COVID pandemic was managed, and all of these issues, will be dealt with, so we can have some transparency and greater accountability for the public funds that were spent
The,
during the
the,
COVID-19 pandemic.
the other issue I wanted to bring up is I remember you spoke about the renal centers. Wasn't there a contract for the setup of renal centers and 4 or 5 renal centers, a government contract that was given out?
So,
Uh,
so you're quite right. In 2011, 12 thereabouts, proposals and contracts, in fact, were signed for two national renal centers, as a public-private partnership, with
correct.
a provider. So one was to be built in Mount Hope, and the other was to be built in San Fernando. Now, when the PNM government took office in 2015, um, And so 9 years later, I think the matter went to court. Um, I'm not too sure what the status of it is, but I can tell you that those centers, have not gotten off the ground. Now, more than that, in the 2022 or 2023 budget, I believe, Minister Imbert, in his budget contribution, came and spoke about a national um, renal center, which was to be built at the Cuba Hospital. That was 2023. In the 2024 budget, we heard nothing of it, and 2025 budget, we heard nothing of it. So the point I made earlier is that we have a great burden of kidney disease patients requiring dialysis, and those patients, um, majority of these patients have to be outsourced to private providers and at a great expenditure to the government. So you're quite right when you recall that that arrangement was in place.
There was also something about diabetes centers too.
Um, yeah, so we were looking at how we would treat with diabetes and so on. But before I leave the issue of renal center, I just want to say that it is the intention when we take back government to ensure that we provide in-house dialysis. We increase the capacity for in-house dialysis at the hospitals, and and look at having a national renal center. That is something that we think is very important. And of course, we will focus on diabetes, both on the prevention of diabetes and the treatment. And that was part of our philosophy and thinking when we had these health centers open, the extended hours, not only to treat patients who may have
Or for
had,
preventive care.
but preventive care. Quite right, Gary. Preventive care. So you could go and get your numbers checked, and that way, So we will move back in that direction.
Now,
And
you
go
mentioned
ahead.
briefly about the ambulances. Now, I have had the misfortune of having to ride in one of those ambulances a while back,
I'm sure
and
that, right. Yeah.
I've had the misfortune of having to ride in one of those ambulances, and they're basically a panel van with a stretcher and a chair for the young lady to sit on to ask if you're all right,
Yeah.
and a bottle of oxygen and a stethoscope. That is all I saw inside there.
Yeah. So the ambulance service, we really need to look at of what we are providing. Now, Gary, you made the point earlier that when you are collected by an ambulance in the US, the paramedics are already phoning into the casualty and letting the doctors know the status of the patient and so on. So by the time you arrive at emergency, they are prepared and waiting for you. So that is something we need to review in terms of what one of the biggest complaints about the ambulance service still, despite the fact that we spend millions every year in paying for ambulance services, is a long waiting time sometimes to get an ambulance. So that is an area that needs to be reviewed. Agreed.
What we have here, for instance, in each municipality, the ambulance are associated with the fire department, and so they're within range. And we have a lot of volunteers, not only paid people, a lot of students, a lot of teachers. In fact, it was a program that I got people to train, like I mentioned earlier, to train our volunteers in Trinidad from out of Jersey City, and the government refused. It was part of the disaster and emergency response training program. These people were willing to donate their time, if we would accommodate them. I also got Hackensack Medical University, the head of that department there, to assist us. And I wrote the Minister of Health, he never responded. That was back, I think, 2017. Brett took was about 2018, I think, must have been. So they are showing no interest in taking any suggestion or anything like that. So I'm definitely looking forward to our government taking our people taking government, and we can get rolling with these things, improve the level of services, things like that. Doc, how is the situation with the dengue in your community or in the country, and what kind of improvement have we seen?
Yeah.
Because I experience. Go ahead.
Yeah. Now, well, I was going to say that this situation, thankfully, this situation, has seemed to have settled a bit. I mean, it's unfortunate that we lost quite a few citizens with dengue. But again, we saw the issue here of the government not being prepared. Um, so there was this whole issue of the insect vector control division, which is supposed to be the government agency that would have looked at, um, you know, doing the preparation for dengue, because we know when the rainy season comes around, the mosquitoes are around. So there was a failure both on the part of the Ministry of Local Government and the Insect Vector Control Division, and as a result of that, we had a proliferation and so on of the mosquitoes, and a few citizens would have lost their lives. But now it seems to be under control. But again, one of our manifesto promises would be to ensure that the insect vector control, which is responsible um, for dealing, taking the measures and so on to prevent mosquitoes and to eradicate mosquitoes, that is well resourced. What we saw during the dengue outbreak a few months ago was the poor and under resourcing of that insect vector control. And in fact, some of the UNC control corporations like the Siparia, Bodoe, and the PNLDB Regional Corporation and others had to take up the slack, when in fact the Ministry of Health and the Ministry of Local Government should have been doing their job.
We've seen all the flooding taking place, and we know a mixture of quality of water, where sewage and all different things will be mixed into that flood water, which will cause some problems for us. And beside this, the mosquito situation. So there's a lot in stake for us to deal with, and we're just kind of concerned. That is one of the concern also. Trini, you have anything else to say?
So basically, we've mentioned a lot, and we are almost out of our hour right now with the doc. Um, but Doc, I would like you basically in concluding to elaborate on some of the measures that you had in place before the PNM took over and they destroyed everything, like the health card, the dialysis centers, and we elaborate on these things and let the population know what they can expect from the UNC government going forward. We already know, the population is already dissatisfied, and they already know the shortcomings of the PNM. So we have to elaborate on what we are capable of giving the population and providing for the future.
Well, we certainly we have a full manifesto um, prepared and ready and waiting. The leader of the opposition would have mentioned on several occasions. But Gary, before I go into that, I just want to agree with you that when you spoke about sending suggestions, to the Minister of Health and to this government, they don't listen. This government does not listen to any suggestions either from citizens or from us in the parliament, because there's a level of arrogance, and they seem to know it all. So I think anything coming from this government now will be too little, too late. I think there's no point in expecting that during this last year in office, if they last a year, whether we can get anything. So I think the population is right to look forward to what the next government, the UN next government, which will be the UNC government, has to offer. Now, in terms of the of what we are going to offer, if you will, just to read a few of the things that we would have put in um, policies we are planning. The Children's Life Fund is an important area, as you know. That would have been started in 2010. Um, and we propose to amend that, the Children's Life Fund Act, so we can have more sick children to access help. As you know, many of those children cannot be treated in Trinidad, and they come abroad, sometimes in the USA. So we want to look at amending that. We want to ensure that the Cuba Children's Hospital is fully equipped and fully staffed and becomes fully operational. Now, one of the issues right now is that the hospital is still underutilized. It was utilized for COVID, but now we have to ask what is happening. Why is it not fully operationalized? So we are going to do that. We're also looking at installing a highly specialized burns unit located centrally, perhaps close to the Point Lisas industrial complex, because as you
With a
know,
heli strap, with a heliport, needs a heliport.
with a heliport, of course. Um, we are looking at expanding and reforming the CDAP program to include a wider range of drugs and newer drugs, as I mentioned. Um, one of the issues that doctors face on a regular basis is the shortage of, of supplies that they require. Sometimes surgeries are postponed because of what you call supply chain issues. So sometimes the drugs are there, the supplies are there, but there's an issue in terms of procurement, having stocks and so on. So we intend to fix that. I mentioned already that we will build a cardiac catheterization laboratory at the San Fernando Hospital. Um, and we also,
I would suggest one for Central also. We need
also
to have. Yeah.
definitely. So the one at San Fernando, and I believe that we will put one at Central as well, perhaps at the Cuba Hospital, because Central certainly needs one. There is one in Eric Williams Medical Sciences Complex. Um, Now, what we want to do, we spoke about timely healthcare. So we are going to establish guaranteed maximum waiting times for things like clinic appointments, for tests, and for surgical procedures. So we are going to say to you that, listen, the longest you will wait for cataract surgery is so and so. The longest you will wait for, your hip replacement is so and so. So we are going to guarantee you that, and we'll link that to a patient's charter, so patients will know what to expect. And of course, if we can't do it in house, well, it means that we have to, um, you know, well, use the external patient program. And I have to mention that the external patient program was created by the People's Partnership government, just to address issues like this, so that if the in-house capacity is not there, we can outsource it, properly accounted for and so on, to make sure patients.
But by the time we get done, Doc, we must make sure that the in-house capacity and capabilities,
Yeah,
we will not be able to do that in the initial stage. But
yeah,
down the road, we want to let people understand that this is where we're heading at, because
definitely.
it's more feasible. Because if you look there right now, there's a young lady in Mayaro has to go to Colombia, and we're trying to raise money. So what I'm looking at is, if we were to bring these doctors within the country of the population, save the hassle, the travel, the inconvenience, and all these things, that I think we could have even at the children's hospital, that we expand that center for those kind of cases, and we bring the specialists in the country, and get a few done, so it will be more feasible that way.
Yeah, yeah. No, definitely. Um, yeah, so I mean, and we spoke, of course, about the COVID-19, the full review of the COVID-19 pandemic. Um, I spoke about the patient's charter, the implementation of the national health card, and there are two other issues I want to close on, which have been issues for this government. One of those was the deaths of the infants at the Port of Spain General Hospital in
Definitely, we wanted to raise that with you. Go ahead.
yeah, that was a big issue. Of course, we had a report from PAHO, and again, you see the irony of this thing. The minister and the government, the, requested this report, and when the report came, they had issues with the report because the report said that there were shortcomings at the Port of Spain Hospital. So instead of trying to say, listen, we are going to fix those issues, they were questioning whether the report was done properly. So we are going to continue. We did quite a bit in the area of maternity and child health in terms of improving the neonatal services and so on, and we will continue to do that. So we will focus again on making pregnancy safe once again, for mothers. Um, I had raised an issue in my budget contribution of maternal deaths at the Mount Hope Maternity Hospital.
Far
Uh,
too many with the cesarean. Far too
yeah,
many.
yeah, which had to be investigated. So we will move to ensure that that we again bring that back to the moorings. Um, so that was one of the issues that we had mentioned, and of course we also want to make sure that we fix the better working conditions for our doctors and nurses, and we will certainly make an effort to ensure that the young doctors who graduate, and paid for by the state, are given the opportunity to do their training in the hospitals and to provide the service for the citizens of Trinidad and Tobago. So I just want to close to say that the next UNC government, um, will have health very high on this agenda. We are very well aware of the problems. We inherited a very poor system in 2010. We were able to fix it, and again in 2025, we will be able to fix the issues that are in the health sector, because the concern of the citizens, second, I would say either second or third to crime on the economy, is health. It's very high up on the agenda in terms of what citizens are most worried about.
Thank you, Doc. That sounds plausible, because the citizens have definitely noticed the difference in what they were receiving for the $7 million that is spent yearly. We are not getting value for money in terms of services or performance in the healthcare system.
Yeah,
Um, so we need to get back to where we were in 2015 along those lines, to get healthcare back in order and get service to the people back on
absolutely,
track.
absolutely.
And this channel is available to you and your colleagues, to bring any issue. We want to keep on educating the people. We want our people outside the country to understand where you're heading at, and not say UNCS PNM is the same thing. We want a clear understanding of what our manifesto is, what our plan of action is. And I want to see us hitting the ground running with addressing the issues, because there's far too many of our people in distress.
Yeah,
They're hanging off a cliff by their finger, so they can't wait.
yeah, definitely.
So
Yeah. So
thank you
thank you,
very much for taking the time,
and
and
thank you,
deeply
Gary.
appreciate it.
Yeah, and thank you
And
very
we
much.
will
And
continue this.
I look forward again to being on the program in the near future.
Thank you very much, sir. Good night.
Thank you.
And
Good.
I want to thank our listening audience for taking the time to join us. And we will, as I said before, we will continue to use this platform to inform and educate you. So by the time the election comes around, you know, fully aware of what decision you're making. Thank you very much. Good night. Thank you very much, Doc.
Thank you.